everyone. I'm at the AHA 2025. I'm at the Orion Health booth, and this has been just such a great meeting. It's a serendipitous meeting here. Talking about this application with Champion the Challenges that we're developing for stroke and heart patients to be their own personal advocate, to be able to go into a doctor's office and know all the information, data about themselves, everything from oral watches to EHR systems like Epic, to Fitbits, to Strava, to everything else. And we have an AI platform right now we're working with, but a lot of the functionality we have right now is Gen AI. It's sort of like, on the front end, it's taking a lot of the care plans and information from the American Heart Association, but what we really need and really want in our Sidekick AI platform, Heart and Stroke app, is integration. Integration with all these platforms, and I happened to stop by this booth, and I met these people to say, we have all these. So you should describe like what you have and how you're going to help us with this personal advocate app that we're developing.
Well, I will pass it along to Dr. Jones here.
Yeah, so Dr. Brian Jones, here with Orion Health. One of the things that you have to think about what you're talking about is data integration, right? Across platforms, because if you're going to surface actionable information for patients or for clinicians, you need a full visibility on the whole care continuum, right? And that's very siloed right now. So if we can collect that information in one spot and then make it actionable using AI to surface the most important parts of it. So when I'm searching as a patient, I don't have a ton of fluff that I have to look through. I get exactly what I want. If I'm a clinician, I get a summary of the patients. I get the information I really need to give them their best outcomes. So how does our AI engine do that?
Yeah, so I mean, the thing that's driven us from day one has been solving that specific problem of patients fall through the gaps because not for the lack of data, but because we don't have the right data in the right hands for the right people at the right time. And so that's what our AI does. It enables that data to be brought together so it's no longer siloed, it's no longer disparate, but it can be reviewed, assessed, processed in real time by clinicians, by patients, whoever it is that needs access to that data in the moment. And yeah, we're really excited to meet folks like yourself who are passionate about that same problem, about collaborating to solve that problem ultimately for patients so they have better outcomes, they can manage their own journey better.
Yeah, I was just curious, like, what do you think? Because my vision is, and I know we can't do this right away because there's so much we can do. There's so many different systems out there, right? I suffered from a cardiac arrest and a heart attack myself. I had various doctors supporting me, people at Duke University, people localized in Arkansas. I have my primary care physician. I have other physicians that are helping me. They all use different medical systems. They're all giving me different devices, and I wear a heart monitor for a while. And actually, I have a story of I was out mountain biking and I was getting erratic heartbeats. And they were going to do ablations. The doctors were actually going to do ablations for me. And then I went to the doctor and we correlated my Strava data to my heart monitor data. And the doctor said, no, there's no reason to get an ablation because there's no pattern here. You were just out mountain biking and then your heart rate was high. So what I'm thinking, and hopefully the platform can help do that, is like look at the medicines people are taking, look at the different monitors that are out there, look at your sleep patterns, look at your EKGs, look at your heart rates, look at your temperature, correlate all this information and use deep learning and AI to then make decisions and educate patients. Do you think that's achievable?
Yes, absolutely, it's achievable, and that's the direction we're moving in, right? We currently can already link up the EHRs and that other disparate data, and there's no limit to the possibilities of connecting with Strava, with Aura, or other products like that. But then also making sure that when that data is collected, that it becomes actionable. I can tell you from a value-based care perspective, working with healthcare systems, that we drown in data, right? But if we have incomplete data or have data we can't use, that's a problem. So we need our programs like Darwin AI to help us make sense of that. And that can make sense of it for different applications for the patients, for the researchers, and for clinicians, and for healthcare systems.
I think you're right. I mean, when I think about it, it's like we're heading every aspect. Although we're focused on the patient, we're actually going to help doctors out, right? Because doctors are very limited. and they have a lot of patients. They have a lot of information they're inundated with it. So us as patients, we can collate the data together using the platform. We can be more educated if we talk to a doctor. Our doctors can make better decisions, and they can actually treat more patients and be more specific and personalized in their treatment of patients. So let me just get back here because I think wrap this up. I think we got a bright future here. The platform is. I was thinking about actually.